I'm Eleni Panagiotakaki. I'm a pediatric neurologist and epileptologist, and I do also a lot of EEG, electrophysiology, in Lyon, France. And with Mathilde and Gaëtan, we are going to present you today this project, the GRIN project, which is an acronym that Mathilde thought of. It's about green genes, related developmental epileptic encephalopathy, natural history study. What is the idealized, personalized medicine paradigm should be like this. You have an epileptic syndrome, then you are able to provide a diagnosis, then you understand the disease mechanism, you are thinking of a drug, you make clinical trials, you can have results. But in the real life, it's much more complicated than this. You can have now, thanks to the expertise of geneticists, a lot of more genetic diagnosis, but that does not mean that we automatically understand the disease mechanism. Sometimes we have the genetic diagnosis, and we do not know how the genes react. We saw this more in the complexity of human body, how the mechanisms guide to the disorder. And sometimes we also can skip the preclinical drug discovery. Sometimes there are already some available drugs that we can use. And with patients and the association pressure, sometimes we're driven to clinical trials very, very rapidly, skipping all those nice steps, and we have a pressure to have outcomes. And sometimes we don't know the natural history of a disorder, of a genetic disorder. That is to say, how the disorder evolves during time, what are all the spectrum of its presentation, and how it is different in different patients. Yes, and we need this in order to provide new treatments. I don't under, yes, sorry. That's a doctor at the end, okay. Let's take a little case of a patient that we have seen in Lyon with a GRIN 2A variant. It's about a 6-year-old boy who at first was diagnosed with a potential intellectual deficiency that was hypothesized by school teachers because now in France there is a pressure to detect very, very early if a child has intellectual deficiency in order to provide care. So this child at the age of 3 or 4 was suspected to have an intellectual deficiency. He was maintained 1 more year in kindergarten school, oriented to a speech therapist, and at the end a geneticist. And very quickly they found out that he was having a GRIN 2A pathogenic loss of function variant. And surprisingly, the father also was having the same thing, but he was considering himself healthy. He had not known symptoms. And this boy, so he came to our department for further workup, and we had a letter saying that he's no epileptic, he has a disability, and as you are experts in genetics, just see him once. We did what we know best, EEG, and he had 4 independent foci, so spike waves in 4 different places in his brain during sleep, and he was not aware of. Under pressure of the family, we put him on L-serine, and with with an improvement, but difficult to measure because mother says, okay, in a scale of 1 to 7, for her, he was much improved, but in what grounds difficult to define. And moreover, some months later, he begins to have focal onset epilepsy seizures, and he is put also on anti-seizure medication. And even more surprisingly, 6 months after L-serine onset, because we asked for a neuropsychological evaluation, but we didn't have it right away, we discovered that he has IQ within normal levels. So a child that came to us as having an intellectual disability ended up being an epileptic one with no intellectual disability, and we don't know the other. We just begin to discover what has in his clinical picture. He has. We see that he has a problem in praxias. He can use his hands with difficulty, very difficult problems in pronunciation and articulation. But all these are left to be done. So, which are the characteristics of GRIN 2A disease in this child? As we say, we don't know exactly yet. And at the end, the child, it is not, it is an elephant. I will explain to you. I don't know if you know this parable, the elephant parable. If you have 6 blind people and they touch an elephant and they have never seen one before and they don't know what it is and they try to describe it. And each one of them touches a different part, and the one it thinks that it's a rope, another that it's a wall, it's a tree, it's a spear. So we have the impression right now that regarding GRIN 2A and GRIN 2B disorders and all we are blind men, each one of with his strong point. For us epileptologists, we see epilepsy first. A psychiatrist will see ADHD or other psychiatric comorbidities, and we know nothing. So that's why we need a natural history study and a prospective one. I mean, not only we need to see the whole elephant with open eyes, but see it also, let's say, from the age of a little elephant, and that will grow and be a huge one, and trying to see how he's growing and what is his aspects as he's growing. So that's why we said we're stopping doing like this, giving L-serine and then seeing the child without measurements, and we should do something prospectively. And why Lyon? Lyon, if you are not aware, so France has Paris is the capital. Lyon is the second city. I hope there's no Marseillaise in the audience, because Marseille, they will say they are the second city. No, it's Lyon. So, and we are here. It's in the, I don't know if the pointer. I don't know. Sorry. So it is in the big department that it is called Auvergne-Rhône-Alpes. It is as it's a huge department with about 10 million people. It's the surface of Swiss. So if we take the area, we cover a lot of patients, and we have referrals because Lyon Hospice Civil de Lyon, it's very reputable in all France, and we have referrals all over France, and we have a huge expertise in genes, genetic disorders, and epilepsy especially. So we since 2012 and we started searching genes that could be implicated in Rolandic epilepsy, that now it is called focal self-limited epilepsy in children. And we found already that GRIN2A was among the big candidates of epilepsy important genes in this kind of very frequent childhood epilepsy. But also the patients that have GRIN2A mutation could have not only this Rolandic epilepsy, but continuous spike waves in sleep, and the Landau-Kleffner syndrome, which is an epileptic acquired aphasia, and an epileptic encephalopathy. All these are papers that where we participated. So we see here that GRIN2A is very important for this kind of disorder. And now with the new techniques of functional, with the loss of function and gain of function characterization of the mutation, we can at some level predict phenotype. GRIN2B, we see here also there are people from our unit. We participated in the identification of GRIN2B also in self-limited focal epilepsies, and the same for GRIN1. With a small number of patients at the beginning, and also in GRIN2D, which is also a candidate for epileptic encephalopathy. So we have a huge interest in Lyon and an expertise in epilepsy and genes. And with the medical genetics team, we are very active and we work very closely. And we growingly have multidisciplinary consultations where the clinician at the same time sees the patient concomitantly with the geneticist. And we have the EEG expertise and clinical expertise. In our unit, the characteristic is that the clinicians, which are specialists in pediatric neurology, read the EEG themselves. So we have the double expertise. And we had a lot of referrals in the national and international levels. Moreover, luckily for us, we had developed lately links with patient associations that we are very thankful on them, because it's the association that pushed us to work more on GRIN disorders. And now, since 1 year, we have, since more than 1 year, we have already 5 pilot patients being placed on L-serine with promising initial results. Since 1 year, a flood of requests for all over France and abroad from patients that want to come to be seen in our center. And to tell you the truth, since I finished the PowerPoint, there was 28 patients. Yesterday it was 32, and it's growing. It's really scary. And we have already seen 13 patients with 3 first inclusions in this prospective study. And we programmed 15 for the 4 following months. These are the dots, the blue dots. You can see how they are dispersed, the patients that contact us until now in the territory. So it's a lot of Bretagne patients, because GRI France, it's a lot of Bretagne, but it is also our region, but even northern France or near the Spanish border. And we really would try to broaden, to make a collaboration and not have a Lyon green project, but a Euro green project within the EpiCare. We would like to develop this natural history project with the help of ESET, which is the European Consortium for Epilepsy Trials, and in order to collect at least 150 patients at a maximum of 10 centers. We're currently searching funding where we are in discussions with partners from industry for this. And as said, will act as an intermediary to have to try to imply the same protocol in all teams to have a universe cohort of patients. So this, it's not exactly the same map as before, because you see that we are trying to make some green dots in other countries. So Italy, Florence, they will participate, and Barcelona also, and maybe Holland or maybe other countries. We are waiting. We are open to discussions and partnerships. And we are very active in the working group 16 of EpiCare, which is the genetic research group with Renzo Guerini, and now it's Gaetan Lesca. I think it's not up to date. And I shortly will present another project, TAP GRIN, that we have had funding and European funding last week for. So it is in partnership with Professor Simona Balestrini in Florence for a double-blind trial of L-serine. So it's double-blind, it's serine versus placebo in patients with loss of function. It is a translational project with a simultaneous functional study of variants in Austria by a laboratory that in organoids like small brains, and aims to bring together 45 patients in the 3 centers, France, Italy, and Poland, with a methodology of small numbers of patients. And we have just had the funding and working on ethical committees approval. So the patients will be monitored not only clinically, but also electrophysiologically with EEG and TMS and other scales to try to find, as we said this morning, the biomarkers that could be used later in clinical trials, and for a minimum period of 1 year. And the third GRIN project in Lyon, that is running in Lyon, is under the supervision of Professor Gaetan Lesca. Corentin Verdun, which is a resident in genetics, is doing his thesis in neurogenetics, and his subject will be to record all cases diagnosed with GRIN gene in France over the period of 2013 to 2023. So the GRIN team Lyon is growing. It's in our department of clinical epileptology, sleep disorders, and functional neurology. We have already 4 persons that are very implicated. In clinical neurogenetics, we have Gaetan, Myriam, Corentin, that they have their little team. And there is a laboratory for monogenic epilepsies with Gaetan, Nicolas Chatron, and encore Myriam. And this is our team with Alexis that was it's in between. So it's it's not in the bottom photo, but it is it was our head of department until 1 year ago. So this is our hospital. We are very eager to start, always smiling and children friendly, and we are waiting to see more patients with GRIN and maybe finding solutions for them. Thank you.